Thank you, CEO, for this. I think it's a very big deal for Kenyans to actually finally have an ambulance service, public ambulance service that runs across the entire country. For many years, we've had mothers dying trying to get to hospital, people in accidents being supported by the public to get out of the accident scene, and many people dying before they even get to hospital. I think with the rollout of this entire emergency healthcare system, supported by SHA, I think it's a significant milestone that will see a significant reduction in all the health metrics that we all normally measure, things like maternal mortality, under 5 deaths, and even just road traffic crash deaths. We'll see a significant drop in the numbers. So the ministry, again through and SHA, are using the WHO emergency care system framework to develop this system, and it's being rolled out in a way that is sustainable to ensure that these emergency healthcare services continue to exist for every Kenyan. And as the CEO has mentioned, it doesn't matter whether you're a SHA member or not. All you need to do is call the number that will be provided, and you don't also need to know exactly what specific emergency. If you're in any emergency, you call the number, the dispatch center will be able to support you and provide the necessary information for you, first of all, to provide that first aid care, and then subsequently the ambulance services to transport you, to provide care for you out in the community and into the nearest emergency center. So in the whole process, again, remember, for the longest, people have had to get care when they get to hospital. What this system is going to do is now start providing care out in the community, save your life out in the community, and transport you to a facility that is able to then continue the care that you'll have received out in the community from the trained responders that will be responding. So it's an exciting milestone. It's actually, I mean, we've all seen the TV series of 911 and ER and all that, and hopefully then, as a country, we'll be able to get to that level, but more importantly, we'll be able to save very many lives that are lost before they get to the hospital. So it's a great day, and we look forward to working together with the government to roll this out and the success of this program. Thank you.
Great. That's it.